Hey everyone, how are you? Welcome to another question and answer session for MRCS exam. First of all, let's see the question. This is the question. A 21-year-old man undergoes surgical removal of impacted third molar. Post-operatively, he is noted to have anesthesia on the anterolateral aspect of the tongue. What is the most likely explanation? So first of all, find out the key point from the question that an old man, 21 years old man, undergoes surgical removal of the impacted third molar. That means the last molar or most inner teeth. Post-operatively, he is noted to have anesthesia on the anterolateral aspect of the tongue. What is most likely explanation? That means injury to which structure causes this anterolateral aspect of the tongue anesthesia, and this nerve passes close to the third molar tooth. Here the options are injury to the hypoglossal nerve, injury to the inferior alveolar nerve, injury to inguinal nerve, lingual nerve, injury to mandibular branch of the facial nerve, and injury to the glossopharyngeal nerve. Now see some of the picture. Here we can see these are the tooth, that means the incisor, canine, premolar and molar also present, and impacted third molar, that means here represent one molar tooth, but there is another two molar tooth also, and we have to find out a structure is which is very close to this third molar tooth. So here this is the third molar tooth, and we can see a nerve is very close to this third molar tooth. So during manipulation of this molar tooth, this nerve may be injured or get damaged. And this picture also, here we can see a nerve is very close to this molar tooth. So a procedure or a removal of the molar tooth, there is a risk of injury to this nerve. And here we can see this nerve also, it is going on the lateral aspect of the oral cavity, so it supplies the tongue, that means the anterolateral surface of the tongue. And here we can see this is the molar tooth, this is the molar tooth, and the nerve is going very close to it, and this is the lingual nerve. So the lingual nerve, it may be get damaged during this operative procedure or during the removal of the molar tooth. So here our answer is now ready. It is injury to the lingual nerve. So when surgical removal of the impacted third molar tooth, there is a risk of the injury to the lingual nerve, because the lingual nerve is very close to this third molar tooth. Other options such as injury to the hypoglossal nerve, it is not true, because hypoglossal nerve, it is purely motor nerve. Then injury to the alveolar inferior alveolar nerve, it's not true, because inferior alveolar nerve, it supplies the tooth area or mandibular area. Then injury to the mandibular branch of the facial nerve, it is not also true, because it gives the motor supply. And injury to the glossopharyngeal nerve, it is not true, because glossopharyngeal nerve, it supplies in the posterior aspect of the oral cavity, not the anterior aspect. Thank you all.